name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, specializing in women's health and hormones. And even if this is your first time, you're who knows how many times watching our videos, if you haven't subscribed to our YouTube channel, please don't forget to subscribe. I hate for you to miss out on any of the great content that we're putting out. And also, if you like the video, don't forget to like it. If you saw my previous video, you now know why. It's been a long time since you've seen me make a video. I had my son about 4 months ago, and apparently I really enjoy just being a mom, and I really didn't have any desire to make any videos, if I'm perfectly honest, and that's okay. I take myself off the hook, but now I'm back at work, back in my office here in New York City. So we're continuing our conversation all about pregnancy in your 40s, and we're kind of wrapping it up with giving birth in your 40s. And again, if you've been watching our videos, you already know, but I can also just tell you again that this is a topic I am very passionate about, not just because I work with people in their 40s trying to get pregnant or are pregnant, but I am a person in their 40s who was pregnant. I'm no longer pregnant. I conceived my son naturally at 42 and just gave birth at the ripe old age of 43. And so I'm very passionate about this topic. And so let's just dive right on in about giving birth in your 40s. So first off, what is it like? Well, I would say, just like anything else, it really depends. One, on the pregnant person in their 40s, current state of health, and also their birthing preferences. So many people in their 40s might choose to give birth in a hospital, either with a OBGYN or a midwife. That's what my husband and I chose. We chose to do a hospital birth with a midwife. Some people in their 40s will choose to do a home birth with a midwife or a birthing center. Again, it really depends on one's preferences, but also their own state of health, I think, should also direct which of those options that they end up choosing. So what is the difference about giving birth in your 40s? What is different about it? So as I mentioned in the previous video, in fact, actually I think it's been in many of the videos, that just being 40 alone is considered an independent risk factor for birth complications, unfortunately. So there's an increased risk of preeclampsia, which is high blood pressure associated with pregnancy, gestational diabetes, placenta previa, which is basically the placenta is not exactly in an ideal position, small birth weight, and stillbirth. So just being in your 40s alone is an independent risk factor. Now, kind of based on that, many OBs and hospital-based midwives will often encourage a scheduled induction between 38 and 40 weeks for people over the age of 40, and that timing will definitely depend on how the pregnancy is progressing. And besides those things that I had mentioned earlier, one of the other reasons is that there is a possibility that being of advanced maternal age does have a negative impact on the placenta, and there's only so much that we can tell about the placenta through monitoring it alone. And I know definitely when I was pregnant with my son, that word induction was definitely thrown out a lot. And so some of the rationale, again, is because the placenta, there's a possibility that it will not be functioning as long as it would in somebody who is younger. Also, that there is an increased risk of stillbirth at 39 weeks for people over the age of 40. Also, there's a slight increase of hypoxia and meconium, so that's the stool that the baby does, aspiration, also at around 39 weeks. So these are some of the rationale of why an OB or midwife might be encouraging induction. Then besides that, there also is a higher percentage of C-section, even if a woman does not have an induction. And I mentioned that in the previous video. Partly this can be due to prolonged labor and also some of those other complications that I had previously mentioned. And regardless though, vaginal birth, even in patients that are above the age of 40, has been shown to be safer than a C-section. And if you're wondering how I ended up giving birth, I actually ended up having a surprise planned C-section, and basically at 38 weeks, my son's growth started to decline and he turned breech, and my husband and I made that decision to have a C-section because again, there's still a lot of things that even in routine monitoring that we still can't tell until the baby is actually born. And at the end of the day, we're happy that we made that decision because there was a complication that could happen regardless of age. And basically at our 6-week appointment, we got the path report, finding out that his cord was hypercoiled. So it had nothing to do with the placenta at all, but it was at the same time a good idea that we had gone through with the C-section. And I'm going to be talking in subsequent videos more on C-section delivery and how to recover naturally from a C-section, but that's just my story aside. So you might be wondering, are there any benefits? What are the benefits of giving birth in your 40s? And I think that the biggest benefit is definitely experience, but also resources, both financial resources in being able to maybe hire a postpartum doula, a night nurse, any other people, other helpers to assist in recovery, but also a greater network of friends, greater support network. And so those would be some of the main benefits, would be more the resources. Then what are some of the risks? And I feel like I've talked about this, but the main risks definitely with giving birth in your 40s are a risk of stillbirth increases, prolonged labor risk increases, which then leads to C-section, but then C-section in itself, one is at an increased risk of having a C-section when giving birth in their 40s. So what are some of the ways that we can make childbirth easier naturally? And these are basically, regardless if you're in your 40s, these could also be for someone giving birth in their 20s. So there's definitely some dietary things that we can do before giving birth. And I would say probably most of these recommendations, I would start a minimum of 2 weeks prior to giving birth. So red raspberry leaf tea, so very strong red raspberry leaf tea. We're talking about 2, 3, 4 cups a day. Definitely want to start that about 2 weeks before, if not, and then often usually starting with 1 cup a day during the 3rd trimester. Red raspberry leaf is a uterine tonic, and we want to make sure that the uterus is working robustly. Dates. So studies have actually shown about 6 dates daily to help ripen the cervix, to help with birth. And then I'd also would say iron-rich foods. So if you hadn't been taking iron as part of your prenatal vitamin or separate from your prenatal vitamin, I would say 1 to 2 weeks before might be a good time to start either adding iron either through supplementation or iron-rich foods, whether it's molasses. I would even say having some liver. Now, typically, usually I'm a little bit cautious with too much vitamin A, which again, you can get from liver. But at this stage of pregnancy, specifically if it's just 1 to 2 weeks out, would not present a risk. I still wouldn't supplement with vitamin A. But again, like increasing iron-rich foods, because if we're thinking about, because regardless of what kind of birth you're giving, there's definitely going to be some blood loss. So we definitely want to make sure that we're getting some iron-rich foods or supplementation. Prenatal yoga is also really good for getting ready for birth. I personally took classes at the Prenatal Yoga Center, which is on the Upper West Side. I love that center in particular, and they also do actually have virtual classes, but prenatal yoga, specifically looking at yoga that isn't just gentle and modified for pregnancy, but actually there's many poses and breath work that we can do that can really help with the birthing process. One from helping with mindset, but also just facilitating pelvic floor muscles and our core muscles and everything that we might need for birth. Acupuncture. So acupuncture can be really great, specifically as we get up for birth, from cervical ripening to natural induction, and even flipping babies. I was not successful. Acupuncture was not successful for me in my case when it came to flipping my baby, but it also, he decided to become breech very last minute. And so I don't know if having given more time, we would have been more successful with acupuncture. Other thing, massage, specifically perineal, so massaging the muscles around the vagina can also be really good before birth. Having a doula for sure can help. Definitely both getting ready for everything you need to know about delivery, also in the room, and then even postpartum. And then lastly, I really would say having an open mind. I think it's wonderful to definitely have a birth plan, but also remembering that anything could happen, and that actually our baby, that there might be things that our baby wants. So the more that we can go, even though I definitely think it's a great idea to plan, but also making sure to have an open mind, because anything can change. So that is birthing in your 40s. If you like this video, don't forget to like it. Of course, definitely don't forget to subscribe to the YouTube channel. I'm in the process, now that I'm fully back, putting together a lot of high quality videos, all geared towards postpartum, which, yes, definitely in your 40s can be helpful, but I would say any age. And again, Dr. Branin of Simplicity Health Associates, I'm looking forward to seeing you next time. Have a wonderful day.